Welcome to the Essentia Health podcast series. I'm your host, Yeji Lee. In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim is always to bring you information or actions to support your well-being that is accessible to everybody. In recent years, the use of e-cigarettes, especially amongst teenagers, has surged with over 2 million U.S. middle and high school students reporting using e-cigarettes in 2002, according to the CDC. This alarming rise in the number of minors using e-cigarettes has raised alarm among many health professionals. In today's podcast, we will be discussing the prevalence of vaping among teens, its associated health risks, and tips for parents on how to stay educated on vaping and ways to reduce or prevent the effects of vaping for your child. Our guest today is Norman Weiniger, Vice President of Clinical Services here at Essentia Health and licensed mental health practitioner with many years of experience working in the mental health field.
Thank you, Yeji, and I'm glad we can try to shed some light on this important topic today.
Thanks for being here, Norman. To start off, can you tell us a bit about the prevalence of vaping among teens and its seemingly sudden rise in popularity amongst young people?
Certainly, Yeji, according to the Centers for Disease Control and Prevention, or the CDC, there are millions of middle school and high school students who are using e-cigarettes. Now, you mentioned that in your introduction, that in 2022, I believe it was, over 2 million middle and high school students were estimated to be using e-cigarettes, with a sizable proportion of them being frequent or daily users. And that's kind of an alarming number. It's about 14% of high schoolers and maybe 3% of middle school students reporting having used e-cigarettes in the last 30 days. The overwhelming majority of e-cigarette products used by teens contain the drug nicotine. This is an issue, of course, because teens who vape nicotine may be more likely to transition into smoking traditional combustible cigarettes, or certainly to become addicted to nicotine, which we know is a highly addictive drug. That addiction can then have negative consequences on their brain development as young people, particularly in the areas of controlling their memory and their learning ability. Now, why are so many middle schoolers and high schoolers vaping? There's probably a lot of different factors, Yeji, that play into that relatively sudden rise in popularity of e-cigarettes. I think some of those are the false perception that they are safe. We also know that the role that social influence, peer pressure, plays with young people in that age group. We also know that there's extensive marketing and advertising that really targets teens in many ways, such as highlighting sweet and fruity flavors like watermelon or raspberry or strawberry or cotton candy and all of that kind of thing. I think there's also a perception out there among teens uh, that there are no consequences for them to use that type of substance. And unfortunately, it looks like that vaping among teens is not just a momentary passing trend, Yeji, but it's really become a serious public health issue. And so we are really happy today that parents would tune into this podcast to learn more.
Thanks, Norman. Yeah, those are very, very alarming stats, especially for that young demographic of people. Diving deeper into this issue of vaping and e-cigarettes, what are some of the negative health effects that vaping poses for teens?
Yes, we should keep in mind that though e-cigarettes and vaping, yet you sometimes framed as being safer alternative to traditional combustible cigarettes, it still contains really significant risks to health, especially for adolescents whose brains and body are still developing. The first one I mentioned earlier is addiction to nicotine. Nicotine is a very highly addictive substance, as any former smokers of traditional cigarettes know. And for teenagers, as I mentioned, it can lead to disruptions in normal brain development. And it can also lead to dependency and withdrawal, which can set off a cycle of irritability and withdrawal symptoms such as anxiety and nervousness and difficulty concentrating and that's that type of thing. And those are related to nicotine addiction, and that addiction does not stop with traditional cigarettes, but extends to this manner of um, receiving nicotine. There are other kinds of health issues because there are other chemicals in e-cigarettes besides nicotine, and those can lead to different sorts of medical and physical issues for teenagers. There are also mental health risks that come from it, such as increased anxiety and depression. The nicotine in it can affect the mood regulating chemicals that are in our brain, and that can lead to emotional instability and irritability, feelings of anxiety and depression. And a lot of young people wrestle with those kinds of feelings anyway. This type of activity can actually make all of that worse. Um, and there's some other uh, issues, health issues, as well as a concern among a lot of people that this type of activity, e-cigarettes and vaping, can be a gateway, if you will, to smoking traditional cigarettes or to the use of other drugs. And Yeji, one more thing, as in the case of most any new product, the long-term effects of vaping are not really fully understood and are still being researched.
Yeah, thank you, Norman, for all of that information on the dangers of vaping for adolescents. Um, for parents, what can they do to help their teens make more informed and safe decisions about their health?
Well, I think this is an area where parents can play a critical role in preventing and addressing vaping among their children. And I think it begins with understanding vaping and how it works, learning about e-cigarettes, familiarizing yourself with the devices. I know I learned a few years ago that these devices come in various shapes, and that can make them easy to conceal, like a highlighter or a pen or a USB drive. I also encourage parents to just stay updated on the trends. This is an industry and activity that's rapidly changing. Try to stay on top of that. The CDC provides good information. So does the American Lung Association. I would also encourage parents to think about learning the signs of when their children may be vaping and you are not otherwise aware of it. And some of the things to look for would be the smell of the vapor, knowing that it can be not it cannot be necessarily smell like a traditional cigarette or tobacco, but it can often be a sweet or fruity kind of smell. And look for a child's behavior that might indicate use of these devices, which can be coughing and throat irritation and that type of thing, or simply more secretive or sneaky behavior. A big point would be, and this I think generalizes to a lot of issues, but to try to have open and honest conversations with your children that's consistent with their age. Meaning, talk to your teens about the risks of these activities. Ask them open-ended questions, for example, about vaping, what they know about it, what they might be interested in. Try to create a space for a dialogue instead of confrontation. Keep in mind that if your teen seems to be feeling especially stressed or anxious or peer pressured, they may turn to vaping as a coping mechanism. So, having a tradition in your home of open conversations around stress and around coping strategies in general could help reduce the risk of them turning to these substances as a way to cope. Now, there are other resources depending on your community. Some schools, for example, Yeji, offer prevention education about vaping. There's also some national helplines that provide free information. One is the National Helpline for Tobacco Cessation. I believe that toll-free number is 800 Quit Now. And as always, we encourage people to reach out to their employee assistance program for further support or consultation on this or most any personal issue that might be of concern. So we hope you will keep the employee assistance program in mind as another resource. Yeji.
Thank you, Norman. This is very important information, and I'm sure that everyone here learned a lot today. It seems that vaping is a rapidly growing issue amongst teens. So I thank you for sharing information on the risks associated with it and various ways that parents can be more informed and equipped when dealing with these issues. So, with that, we conclude today's podcast. On behalf of everyone here at Essentra Health, thank you for listening.